Mammograms by Michelle Hackett at Rowan University. Mammograms, a screening test. Screening tests are used to evaluate a population of people for a specific disease without signs or symptoms of the disease present. Usually, it's undertaken in a target population which has a significantly high risk of developing a particular disease. Screening tests should be able to detect a disease at a very early stage when they are still curable or at least treatable. A mammogram is a screening technique used for breast cancer, and the target population for a mammogram are women aged 40 and over. And according to the Mayo Clinic, most experts do not see benefit in screening women past the age of 74. Recommendations by the U.S. Preventive Service state women between 50 and 54 should be screened annually before converting to a biannual mammogram at 55 and beyond. Breast cancer is the most common cancer in women, regardless of race or ethnicity, and it can spread or metastasize to lymph nodes and other organs and body parts. The disease is predominantly in women, but men can get breast cancer also. Recommendations by the CDC and the Mayo Clinic state that women between 50 and 54 should be screened annually. They see no benefit in screening women after the age of 74 under the surmisation that another illness will interfere with their lifespan before breast cancer will. It is important to realize that screening for mammograms does not prevent the occurrence of breast cancer, but instead it only provides a very simple and useful tool to detect breast cancer at an early and treatable or curable stage. Mammograms are capable of detecting breast cancer at a stage prior to the infiltration of the tumor into the surrounding tissue or structures, which is called stage 0 breast cancer or carcinoma in situ. The gold standard for breast cancer detection and diagnosis is the mammogram. As a matter of fact, the mammogram is the only accepted screening technique for detecting breast cancer at this time. Mammograms are very effective at detecting breast cancer at a very early stage, again where cure or treatment is possible. Up till now, breast mammograms have likely saved the lives of thousands of women by detecting the disease when it was most curable and undetectable by any other means. Mammograms are just an X-ray photograph of your breast, which works essentially like any other X-ray. The breast tissue is compressed between two plates and a picture is taken. A radiologist evaluates the films and determines if there are any abnormalities seen. Breast cancer usually appears in the form of calcifications, architectural distortions, or abnormal densities. Diagnostics for mammograms include digital mammography, ultrasound breast imaging, and MRI. These are usually used in conjunction with a mammogram when there are abnormalities on the mammogram for verification or confirmation of disease. Breast cancer is the most common cancer in American women, with the exception for skin cancers. Currently, the average risk of a woman in the United States is about 13%, or 1 in 8 women will develop breast cancer. The American Cancer Society estimates that breast cancer rates for 2020 are about 276,480 new cases, 48,530 in situ cases, 3.5 million breast cancer survivors, including those still going through treatment, and it's the second leading cause of death besides lung cancer and will kill approximately 42,170 women this year. The rates seem to be decreasing because detection has improved, as have treatments. Risk factors for breast cancer include gender, simply being a woman. Age, it usually affects older women after the age of 55. A family history, particularly in a first-degree relative. Gene changes, which are related to the BRCA1 and BRCA2 genes, which are also um, concurrent or congruent with ovarian cancer. Previous breast cancers increase the risk. Radiation exposure at an early age, or hormone exposure at a later age, as well as benign breast biopsies, which sometimes convert to breast cancers. The primary types of breast cancer include ductal carcinoma, which, as its name implies, affects the milk ducts in the breasts. Lobular carcinoma, which affects the lobules, which are the glands just above the ducts. Inflammatory breast cancer, which presents as an inflamed, reddened breast, which looks like the skin of an orange. And triple negative breast cancer, which is essentially free of any hormones. Recurrent breast cancers are also a distinct type in themselves, which occurs once a woman has gone through treatment and entered remission. Signs and symptoms of breast cancer include a new lump or mass, irritated dimpled breast or nipple pain, a nipple that points inward or an inverted nipple, red scaly or thickened nipples or breasts, and nipple discharge other than milk. Treatment options for breast cancer include breast cancer surgery, radiation treatment, or systemic, which is also chemotherapy treatment. The treatment type depends on the stage, type, and grade of cancer, and whether it has spread to other organs, as well as age, health history, and personal goals for treatment or cure. Entire teams of specialists, including doctors, surgeons, oncologists, nurses, and radiologists, nutritionists, all participate in the treatment and care plan for breast cancer patients. Treatment in the asymptomatic phase has to yield a superior result to that obtained by delaying treatment until symptoms appear. Treatments in the asymptomatic phase of breast cancer are optional from most invasive, which is a lumpectomy, from least invasive, which is a lumpectomy, to the most invasive, which is chemotherapy. Mastectomy and radiations are options as well. As far as quantity and quality of life, metastatic breast cancer can affect one's overall quality of life and day-to-day living challenges. Quality of life encompasses more than just physical health and includes emotional well-being, sexual health, pain, and financial security. Though you may find it more difficult to manage your diagnosis at times, there are some things that women can do to manage their quality of life. Manage your pain. Make sure that pain is not allowed to get out of hand and that your pain goals and needs are discussed with your physician. Create a relaxing bedtime ritual. Try to calm and soothe yourself. Keep the bedroom dark and cool. Keep electronics out of the bedroom unless they are those that encourage and promote calm. Avoid having a large meal before bed, and avoid alcohol and nicotine products. Focus on one's mental health. Up to 1 in every 4 people with cancer are diagnosed with depression that must be treated and addressed. A positive frame of mind is essential to women being able to successfully participate in care and treatment. Don't be ashamed to allow yourself the necessary time to focus on your mental health and to reach out to others to help you during this time. Living with cancer can cause a great deal of stress. Participating in yoga, tai chi, meditation, and breathing exercises are beneficial, as are massage and music therapies, and many of these therapies are available through treatment centers. Join a support group and stay organized. Some of the apps listed that help with keeping organized with both your personal life and your cancer plan are the Care Zone, the Health Line, My Cancer Coach, and NCCN's reimbursement resources. In addition, don't ignore medication side effects. Make sure that they are immediately discussed and addressed with your doctor. And let somebody else do the cleaning for you for a while. Take it easy. Your body really will not be up to the task, because cancer in itself and treatment often cause persistent fatigue. Find a hobby, something to soothe you, like painting, hiking, swimming, pottery, reading, knitting, or yoga. Thank you for your time, and I hope that this presentation was beneficial to those watching.